Why did prescription opioids bring so much misery to the small towns of post-industrial America? The standard narrative is to put all the blame on OxyContin, a powerful painkiller pushed on rural America by the profiteers at Purdue Pharma.
Under a settlement agreement, Purdue would plead guilty to 3 federal criminal charges related to its role in pushing the powerful painkiller OxyContin.
In this telling, the opioid epidemic is a morality tale of capitalism run amok and regulation made toothless by anti-government zealots. Sally Satel, a practicing psychiatrist and resident scholar at the American Enterprise Institute, has a more complicated story to tell. In 2018, she moved to Ironton, Ohio, a small, economically depressed town in Appalachia. With the help of hillbilly elegy author J.D. Vance, she found a job working with patients and social service providers to better understand the opioid epidemic. Satel says that the opioid crisis didn't start with OxyContin. It was a natural outgrowth of a century-old tradition of medicating pain as a way of tending to the broken bodies of the region's laborers.
All the men worked in these very physically brutal jobs, and if they couldn't work, they couldn't live there. Even though many of them were in agony, they had to work, and the coal camp doctor who was employed by the company had to get them into the mines, so they medicated them so that they could work, which is not to say that the medication might not have been indicated alone for pain control, but it also is a way to make sure that the labor continued. There had been trafficking of prescription pills for a long time, gray market pills, mainly Percocet, Lortab, Vicodin, oxycodone.
Satel stresses that when the Purdue sales force came to small towns in Appalachia, it was pushing on open clinic doors. Their product, OxyContin, was a particularly potent form of oxycodone.
Your average Percocet is 5 to 10 milligrams of oxycodone, but an OxyContin pill can have up to 80 milligrams.
But there was a reason for that potency. The drug was engineered to release the medication slowly over a longer period of time.
The appeal of OxyContin is that it was long-acting, so that if you had chronic pain, you had a more steady blood level. That is a pharmacologically legitimate strategy.